Hello, welcome to Franklin County Home Health Agency's Where the Heart Is. I'm Jennifer DeSablo, your host for today's show. Franklin County Home Health Agency is a nonprofit home health care organization that has been serving the 15 cities and towns of Franklin County since 1969. We are happy to bring you this monthly show dedicated to giving you information about our agency's programs and services, as well as helpful tips to help you stay safe and healthy at home. On today's program, we'll be getting an update about the agency's current year and what's new at the agency. I have three guests with me today from Franklin County Home Health. Janet McCarthy is our agency's Executive Director. Barbara Murphy is our board chair with the board of directors, and Gina Clark, a board member as well. So thank you, Gina, Barbara, and Janet for being here today.
You're welcome. We're happy to be here.
Sure. So let's start with, it is September, and this is the time of year that the agency holds its annual meeting. So this is an opportunity for us to talk about what's been happening at the agency in that year, and we share that with our staff and friends and community members. So let's do a little bit of that here today. Janet, can you give us an overview, before we get into that, a quick overview of the agency's programs and services and what we do in Franklin County?
Sure, I'm happy to do that. So we provide home care, hospice, and other support services to help people stay at home, recover from illness and injury. We provide services throughout all of Franklin County. We have a staff of about 200 employees, and we made about 80,000 visits during our last 12 months. So we're an organization that touches many, many people in our community to try to really improve the lives of our community.
Absolutely. And so as a nonprofit agency, we rely very heavily on a board of directors to help us out and provide some leadership. So Barbara and Gina, there are many opportunities in Franklin County to serve on boards, and I'm sure you've both had many opportunities. Why is it that you serve your time and your talents right now with Franklin County Home Health Agency?
I have been on several boards and serve on a few others currently, but home health has definitely captured my heart for about the last 15 years. My parents and grandparents all benefited from home health care. I think it's critical within our medical services industry that it survive, and I hope that by giving some of my time, being on the board, the small things that I can do, that I can help in that process of keeping it current and able to survive in the financial experience that all medical care is having right now.
Absolutely, thank you. And Gina, how about yourself?
It's a chance for me to give back for the services that my family received. I'm indebted to the agency for the services they provided. And I'm one sibling in the state of Vermont. Everybody else is out of state. It was extremely helpful, to me and to my family. And it's very comforting to have someone come in and talk to you and walk you through what's going on. And the hospice was one of the things that we benefited from. But I think I just wanted to interject that I thought home health was all about aging and the process of dying. And home health does so much more. Yeah. And serving on the board, I'm just blown away by what it does for our community with children and for example.
You bring up many good points, just your experience alone being a child with other people not around. You talk about a lot of what many of our clients go through.
I was unable to do it. I tried.
Sure. Oh, yeah.
If I wasn't for home health, I wouldn't have.
We're there to help.
Yes.
And that's another thing. I think you bring up a good point that when you serve on a board, you learn so much more about it. And it's why we're here today also, why we're here every month to share what home health does. Because as you mentioned, we do a lot of the care for the aging. But Janet, talk about that whole spectrum a little bit.
Yeah, well, actually, it's a great segue for me because as I sit here and listen to you talk, I think about what has kept me here and why is it important for the work that I do. I've been with Franklin County Home Health for many years now, and I am also, my family's also the recipient of some of the services of Franklin County Home Health or a sister VNA throughout the state, and we do provide services that touch the lives of our young families, whether they're having babies, going to childbirth education classes, receiving support and education as the new families learn how to care for that brand new baby, you know, to working, you know, the working youth or children with disabilities, all the way up to our aging folks who really want to stay in their homes as long as possible, and you know, to those who are facing end of life, regardless of what age.
Very good. And so, Janet, this is the time of year in our annual report we give some updates to our programs and services, how we're doing as an agency. You've mentioned a few that make me think of some of our newer programs. Can you give us an update on what's happening with some of the agency's newer programs in this past year?
Sure. You know, it's been a very, very busy year. I think anybody that works in healthcare these days has to have their running sneakers on for sure. But, you know, we're very proud of the implementation of our Nurse Family Partnership Program, which is a program that helps to support first-time pregnant women in our community. We're about to celebrate our second birthday. Our first child admitted to the program is turning 2 next month, and that just doesn't seem possible. So we have served quite a number of individuals and are really seeing some very positive outcomes and positive things happening for our young families in our community. So that's been big. We not only provide that program in Franklin County, but we also provide it in Lamoille County, and we've been recently approved to provide that in Grand Isle as well. So that's an expansion of services that, you know, will help to support our youth in our community. We've been very involved in healthcare reform activities over the last year. We are members of the networks for the One Care Vermont Accountable Care Organization and also the Community Health Accountable Care Organization as well. Both of these organizations are established to try to improve patient outcomes, reduce the cost of care, and improve patient experiences. And we're very pleased to be part of that network. We think that we can help you know, achieve improvements in our healthcare in our local community, but that's taken quite a lot. You know, we're learning all the time about how to improve the way that we provide care. So we've had quite a number of our staff retire this past year, and so we've been very busy recruiting and hiring replacement staff for those, and it takes quite a bit to train individuals to be able to go out and knock on doors and be able to assess patients and provide care independent in an independent environment.
It takes special people.
And it absolutely takes a special person to do that, for sure.
Including rowing boats to get
all kinds of things. You know, last winter was very challenging with the ice and snow, and we had very few visits that we weren't able to make because of the commitment of our staff and management team support to kind of reroute people or make sure that people got where they needed to go.
Because you're right, we should remind people we serve all of 15 cities and towns, and that means some back roads and hills and dirt roads, but we make it there, so it's a big accomplishment.
It is. Sometimes it's greater than others.
It's dedicated individuals.
For sure. So that's great, Janet. Thank you for sharing. We'll talk a little bit more about that reform you were talking about and the impact on the agency. But while we're talking about this annual meeting, what are some of the things that you do special there? I know it's a time of recognition. So what do we recognize at the annual meeting?
Well, first of all, we recognize our board and our board leadership. That's always a nice time to say thank you to our board of directors who really provide so much time, talent, treasure, wisdom to making sure that our organization runs the way it should. So we, you know, bring on new board members and say farewell and thanks to board members who are going off the board. We have 3 awards that we present at the annual meeting. The first is the Orrin J. Lane Award, which is given to recognize an individual or group in our community that has gone above and beyond to serve our community. And that's named after Reverend Orrin Lane, who was a former spiritual advisor for our hospice program and very important and special to our organization. The second award is also named after a former board member, Patricia Dean Make a Difference Award, and that is given to a staff member who is recognized for, again, going above and beyond, whether it's in the work or in the community. And the third award is named the Edward Eaton Award, Make a Difference Award, and Mr. Eaton was a longtime member of our board of directors who was just very impassioned about volunteering in the community and supporting not only our work, but he also supported Care Partners and just loved to give back to the community. And so we designate individuals for that award as well.
Mm-hmm. That's
one of
right.
our volunteers.
Sure. Yeah, recognition is so important. It's nice to see that you have so many wonderful people to recognize and in honor of such great people that many of us recognize and remember. So we recognize staff and community members, and we have a large staff of volunteers. We have our board members who volunteer, and we also have volunteers at the agency. Can you tell us about the other volunteers the agency has?
Yeah, so we have quite a contingent of hospice volunteers and other volunteers that actually just come in to help us in with whatever might need to be. So our hospice volunteers participate in a hospice training. They actually go out and they make visits and provide companionship or take our patients out on rides, and just really are an important part of that end-of-life experience for our hospice patients and their families. But we also have a lot of other kinds of things that volunteers participate in. We have our big Blue Jean Ball coming up, which is our major fundraiser, and we rely on volunteers to help us with that, whether it's solicitation of sponsorships or items for our auction, or helping with our decorations, or setting up or taking down or putting away, or all kinds of opportunities. And I think last year we had over 50 people just help with that event alone. So lots of opportunities for volunteers, and we really appreciate and rely on them as vital members of our team.
So volunteering, go ahead, Barbara.
Well, I was just going to say, having been involved with the Blue Jean Ball for a couple of years, as someone who accumulates some of the items for the auction and just has the opportunity to request from my community members these donations, I love the support that the community is given through that. I have regulars who just know to present, and I think it's another piece of showing how much our agency is appreciated and acknowledged as part of the community.
Thank you. Yeah, we have you're mentioning that you solicit items for our auction at the event. We have many beautiful items this year. It's going to be quite an event. Can you just give us viewers who don't know about the Blue Jean Ball, what is the Blue Jean Ball, what does it raise funds for, and what can they expect if you're going to the Blue Jean Ball?
Well, one of the things that we do is provide care to those individuals in our community who don't have the financial resources to pay for their home health care. So it may be they don't have insurance, or there's substantial copays or deductibles or whatever. So we do rely on community donations and our fund development. So the Blue Jean Ball is one way that we do that. We raise, I think we raised almost $40,000 last year. It's a fun event. It's October 25th, and we hope that people will go online, buy tickets, or give us a call and buy tickets.
And the theme this year?
The Blue Jean Ball is going to paradise this year, so
I'm kind of looking forward to it.
Yeah, so we've had fun with different themes. It's a dinner, it's a dancing, music, auction items, some fun, all kinds of fun and games, but just really a nice opportunity for our community to come together to support the work that our organization does.
And you have to wear
You have to wear blue jeans.
All the better. We want to make it fun. We call it casually elegant evening. So, so coming to an event is one way to help volunteering. What other ways? You did mention town funding and other support. Can you talk more about the support the agency receives financially in our community?
Well, certainly our Blue Jean Ball, so our fund, that's important. We do receive funds from all of the towns and municipalities in Franklin County. We're very grateful for that through the votership during town meeting days, and we hope that our communities will continue to support our work through that. We also are the recipient of some money from the United Way, Franklin Grand Isle United Way. They're about ready to hit their kickoff campaign, and we as an organization support that. We ask our employees to consider making contributions to the United Way as part of their annual campaign. And lastly, we receive donations and bequests from our community, and we really appreciate those memorial contributions or gifts given in tribute. And it all comes together to be a very important part of our revenue stream.
Absolutely.
One of the things we did fairly recently in determining the town amounts that we request is base it on the 2014 census and ask each community town to give $2 per head of that count. And I think that it's important for communities to understand how that number is assessed, and I like being able to give that image of it wouldn't even cover a fancy cup of coffee, basically what we're asking each person to support the agency.
Absolutely. And we do, you have helped us with that before, that we do offer a lot of information to each town specific to how we serve each town.
Right.
So it's good to see that too. I think it gives a chance for our community to really get a picture of what
Right.
we're doing with their neighbors and loved ones, and what it'd be like without home health here. So,
Exactly.
yeah, it's great. Thank you. So let's talk a little bit about the state of home care right now. What's changing? What is the board doing to prepare for changes, and what our patients and people in our community can expect?
Well, I think be interested to hear your perspectives, but I think one of the things that our board has tried to do is really help our organization be positioned for change in the future. So during this last year, I think about a significant investment that the board approved in upgrading our information technology system. We have, our nurses and therapists have used laptops out as they've been making home visits for years. We were one of the first in the state to adopt that technology, and it was time this spring to upgrade that. And as anybody who's gone out to buy a computer lately knows, that's not cheap or inexpensive. So I'm very appreciative of the board's support in making sure that our staff has the tools and technology to be able to make the visits. That positions us well, I think, for some of the healthcare reform efforts. A lot of the information or a lot of the planning that is going on is very data driven. And so, we'll be spending the next year really looking at how do we learn about the care that we provide to patients by being able to extract information from the data, and hopefully we'll be able to use technology. But I mentioned earlier are members of the accountable care organizations, and I think that's really the big steam right now in Vermont for how to provide patient care in a different way. And so we think home care is part of that solution.
And part of that accountable care, who are the other members involved in that, or who are the players?
So the accountable care organizations networks include all of the hospitals in Vermont, includes almost all of the primary care practices, physicians in Vermont, many of the specialists, all of the nonprofit home health agencies are part of that network. The community mental health organizations are part of that. Skilled nursing facilities, all of our local nursing homes are in that network. So it's really the provider community that is coming together to say, how do we provide care in a consistent and standard way to deliver the outcomes and quality that our community should and expect to receive.
That's excellent. Those are groups that we work very closely with as it is, so that's going to be, how do you feel that's going to go in the future?
If we have such a great system of care in Franklin County, I think because of our geographical presence with the mountains huge on one side, the Canadian border, and the lake on the other side, we really have to work together. Most people that work in Franklin County also live in Franklin County, so. And play in Franklin County. If you don't see them at the grocery store, you'll see them out on the soccer field. Sure. So I think it does provide us with opportunities to not only work together professionally, but personally as well.
Mm-hmm. Mm-hmm. Excellent. So Janet, can you talk with us a little bit more? One thing that came to mind when you mentioned some new programs that we didn't talk about was Start Your Conversation. I just want to bring that up. It's something that we like to try to get out in the community and let people know what that program's about. What is Start the Conversation?
So we have been providing hospice services since the mid-70s, I guess, as through one of the 5 demonstration sites in Vermont, one of 23 across the nation. And, hospice provides care to end of life. And sometimes those conversations about what people's wishes are, or how do you talk to a loved one after they've learned that their life expectancy is short. And so we worked with our other sister home health agencies a couple years ago to develop some materials called Start the Conversation. And we've been going out to groups and meeting with individuals to help people learn how to have those conversations and encourage people to think and communicate about what their wishes might be at the end of life. Mm-hmm. Our philosophy has always been that death is a part of life and should be embraced. And so this is just one way that we can enhance and make those conversations easier for people.
Mm-hmm.
It's a program that I'm glad you brought up, because we do want it to get a little more attention than some of us have seen. I know that there's diligent action on getting the word out, but it is important that people understand the hospice program has got a time spectrum that makes it of greater value than if it's just that last week or two when someone's at that final point of dying, because the intent of hospice is that everyone is able to have that preparation time, and the family has time on board with the comfort level of being able to acknowledge a good life lived. So I appreciate that you brought the program up again.
What you're mentioning is sometimes we don't learn about it until it's very close to the end. If we knew a little more about it in planning time, we can get more comfortable with the idea. It's never going to be very easy, but I think that's what this program is trying to help people do, is have those conversations that we all know can be difficult, but it's going a little further than just saying, did you do your living will, as I understand, so that we have opportunities to kind of role play and have that discussion with your family members or the people who will be involved. So yeah, it would be, if people have questions about that program, what do they need to do? Can they
can call us at 527-7531, and we'd be happy to try to provide them with more information. We've done presentations for a number of groups throughout the community. They've been very well received, and it's been a great opportunity to just really start the conversation, to help people feel more comfortable.
The piece that, I'm sorry, the piece that I remember from it when it was presented to me in its infancy is that it comes with a pair of tea bags, which I think is a lovely connection to starting the conversation. That make a pot of tea and sit down, relax, be comfortable.
Sure. Gina, you were going to add?
You have to hear things like 10 times for it to sink in, you know. I mean, so I just think that, the earlier you start that conversation, it's important. It's hard enough to go through the process of a family member or someone that you really care about passing away, and so if you have all your things set up, it makes it, you're doing the right thing.
Yeah, and it's just kind of, it's really just help. It does improve the quality of the process. And, when it does, who knows what, can we talk about this? When you get it out and have a constructive conversation, it really
you mix all those siblings together.
Yes,
and
for better or worse.
It's a hard time. It's a hard time.
And you speak to the hospice program itself, that there is that aftermath of after the person has passed, there are services offered to the surviving family members.
I benefited myself, not just the patient from the hospice.
Right.
And one of the things I remember, and I don't know if was the Final Gifts book. I love that book.
Yeah, she's mentioned we have a library at the agency you can borrow things.
That helped me so much.
Yeah, it's a wonderful book.
So the preparation, being prepared.
Absolutely.
I think one piece that the board had a lot of work on this year that we have brought to fruition is a complete rework of our bylaws, just updating them. There was a bit of a scramble as they'd been updated over the years of them being kind of a mixed match of pieces we borrowed from places that didn't really fit or serve our intent and true action. So that's a piece that I think the board really did implement and provide this year, was leadership, especially our, as we like to call him, volunteer lawyer on the board. Helped us clean up the verbiage and have that be proper. So.
But what an important job, as you say. Let's, going into the future, have the right leadership and bylaws there. That's great. Thank you.
And also, Janet does a really good job of having a wide variety of people serving on the board. You try to have different individuals with different strengths, and so we look for certain areas when someone's going off to replace.
Yeah, I think the board serves an advisory and provides oversight, so it's really nice to have a wide variety of dimensions. People come to the board with experience in finance or healthcare or community relations, promotion. Yes, fundraising is really important. And familiarity with our services. The state of Vermont requires that 51% of our board have had personal experience of either being cared for themselves or a family member being cared for. So, that consumer voice is really critical.
And you try to have representation from each town.
Yes,
on the board. So, that's good.
And you mentioned consumer voice, just made me think, can you talk to us about what we gather from our patients as far as satisfaction goes and how that is important to our work of our agency?
So as a Medicare certified agency, we're required to have a third party administer a patient satisfaction survey to our home care patients, and starting in January our hospice families will also receive a patient satisfaction survey that is a standardized tool that's going to be used across the entire United States. So it's been very valuable for us. We're able to keep track of how we're doing, what our patients' experience is, and learn from those survey tools, and we'll be doing the same thing with hospice.
Mm-hmm. Good. Yeah, we want to hear good or bad.
Absolutely.
We want to hear feedback, or good, bad, in between.
Yeah. Our patient satisfaction scores continue to be very high. You know, the national average for the highest of patient satisfaction is 84, and our newest report shows our satisfaction score is 95. So 95% of the patients with us are highly satisfied with the care that we've provided, and we're proud of that, and want to say thanks to our community for those ratings, but I think more importantly, thanks to our staff who really provide the care that makes our patients have a positive experience.
Absolutely. Well, I was going to say that we do staff appreciation at this meeting, but we moved that to another time of year. But when you were mentioning thanking our staff, I think of that, how we've talked about the loyalty of staff. There are some people there. How long is the longest person there at the agency?
Oh, the longest person that's been at Franklin County right now is Margaret Pilcher, who's been with us for 36 years. She's been doing childbirth education and some maternal child services and home care throughout the years. If you've had a baby in Franklin County in the last 35 years, you probably had Margaret teaching you how to do it. Yeah. So we're very appreciative, but we have many other staff members. We recognized some longevity, years of service back in the springtime, and it's always fun to see you know, how long people have been with us. Very, very loyal to our organization, but it's not just the organization. They're very loyal. They love the work that they do, and they're passionate about it.
Absolutely.
Patrick is coming back on, and he's been very loyal on the board.
That's right. That's right. Our board members have been very loyal as well. Yeah.
So a quick recap of some of the things that are coming up at the agency, dates and events.
Yeah, so we have our annual meeting coming up in September, which is during the airtime, the show that the show is going to be airing. Our Blue Jean Ball is coming up on October 25th. And in November, we'll celebrate National Home Care and Hospice Month. So we're looking forward to these next 3 months.
Absolutely. So we're coming close to the end of the show. Is there anything else you'd like to share before we close?
The petitions, do we want to talk about that?
There are a couple of communities that we did petition for the community piece of our funding.
Okay.
And I think that's maybe what Gina's referring to, that in some communities we do it through that process, and we haven't completely determined if that's going to be necessary in each, but I know in Fairfax last year I did take a petition around town looking for signatures, and had great support from the community for making the donations. So
thank you for
potentially I'll be doing that again, but I don't know if the select board will decide just to enter it as a piece of our town budget based on that.
Which some towns do, but some towns.
Sure.
Well, I just would like to say thank you to our community for the support, and also thank you to our board and its leadership, and very importantly, thank you to all of our staff who, you know, do tremendous work day in, day out, 365 days a year, in the middle of the night, snowstorm or whatever. You know, their compassion and commitment is phenomenal.
Excellent. Thank you, Janet. And thank you for watching. If you have any questions about the agency's programs and services, please call our agency at 527-7531 or check us out online at www.fchha.org. We appreciate you watching and hope that you will learn more information about Franklin County Home Health. Thank you. Be well.